Neurogenic bladder is a dysfunction that results from lesion of the nervous system. So, neurogenic bladder means from the name itself, it indicates that it is neurogenic. That means dysfunction in the nervous system that leads to dysfunction of bladder. That is known as neurogenic bladder. The main etiology of this condition, neurogenic bladder, is spinal cord injury, spinal cord tumor, then herniated vertebral disc or disc prolapse, then multiple sclerosis, congenital anomalies such as spina bifida, myelomeningocele in case of infection, and diabetes mellitus. Normally, bladder emptying is activated by micturition reflex arc within the sympathetic and parasympathetic nervous system, which causes coordinated sequence of events. So here, initiation of voiding that occurs when the efferent pelvic nerve, which originate from S2 and S4, stimulates the bladder to contract, resulting in complete relaxation of the striated urethral sphincter followed by fall in urethral pressure and contraction of the detrusor muscle. Opening of this vessel neck and proximal urethra that will helps to flow of urine or emptying the urine. So there are lot of sequence will be happen in micturition process. In neurogenic bladder, when the nerves are affected, nervous system is affected, this communication will not takes place. That's why there is no control over the bladder function. That leads to neurogenic bladder. There are two types of neurogenic bladder. First one, spastic bladder or the overactive bladder. This spastic bladder, otherwise known as reflex bladder. Spastic bladder is the most common type of neurogenic bladder. This spastic bladder mainly caused by spinal cord lesion that is above the voiding reflex arc. That is, upper motor neuron lesions will be affected in case of overactive bladder or the spastic bladder. Due to that, there will be loss of conscious sensation and cerebral motor control. So that the spastic bladder empties on reflex with minimal or no controlling influence to regulate its activity. So when the person, if the person have spastic bladder, when the person empties bladder continuously, there is no regulation or there is no control over the bladder. So that's why the bladder will be continuously emit or emptying. Okay, so that happens in overactive bladder. Next one is the flaccid bladder. Flaccid bladder, otherwise known as underactive bladder. So flaccid bladder, it is caused by lower motor neuron lesion, commonly resulting from trauma. This is a form of neurogenic bladder, has increasingly been recognized as a problem in patients with diabetes mellitus. The bladder continues to fill and becomes greatly distended and overflow incontinence occurs. The bladder muscles does not contract forcefully at any time because sensory loss may accompany this flaccid bladder and the patient feels no discomfort. So that's why when if the person have flaccid bladder, the person doesn't feel the fullness of bladder. So he will not empty the bladder and at last there will be overflow incontinence occurs in the flaccid bladder because this bladder is underactive. When the bladder is full also, the person will not feel the fullness of bladder. So uh, at last the bladder will be overflow occurs and empty the bladder. The main clinical features that can be seen in neurogenic bladder is urine leakage, then urinary retention, especially in case of flaccid bladder, then kidney damage. The bladder becomes too full and urine backs up to the kidney, and the extra pressure may leads to blood in the urine. So gradually there will be chance for renal failure or kidney damage. Then there is increased chance for infection because the urine is held in the body for a long time, so that there is increased chance of infection. The urine leakage is the incontinence. Okay, so continuous there will be incontinence also will be present as a feature of neurogenic bladder. A diagnostic test for neurogenic bladder, it includes the assessment of history, then assessment of fluid intake output chart, then residual urine volume analysis, then urine analysis and urine culture, then cystoscopy, then urodynamic test for assessment of bladder stores or release of urine, then imagery, that is CT scan, MRI, X-ray, all those things can be done in order to confirm the neurogenic bladder. The main diagnostic test is the urodynamic studies. The main management for the neurogenic bladder is continuous or intermittent or self-catheterization or external condom type catheterization, and diet that low in calcium in order to prevent urolithiasis. Then a double voiding technique. So double voiding techniques mainly useful in flaccid bladder, that is underactive bladder. So here, after each voiding, individual remains on the toilet and relaxes for 1 to 2 minutes and then attempts to void again in an effort to further empty the bladder. So that is known as double voiding. Then anticholinergic drugs, beta stimulants also can be used. Then surgical procedures include intramural botulinum toxin A, bladder augmentation, then catheterizable stoma, bladder neck surgery and injections, then vesicostomy, suprapubic catheter, and other surgical techniques also can be followed. The main management is catheterization. And if the surgery is possible, the surgical management correction is done.